Now I'll request Dr. Pankaj Kumbhar to present his paper on community-based care models can lead well-being and welfare of elderly in rural area. So over to you, Dr. Pankaj.
Yeah, thank you. Are my slides are visible, sir?
Yes, please go ahead.
Yeah. So good afternoon, everyone, and thank you very much for giving me a opportunity to share my minds on community-based care models can lead the well-being and the welfare of elderly in a rural area. Basically, just I will be talking in context of the social perspective, because since I'm from the social background and I came across the various issues on the ground. So I thought that I'll be presenting this in terms of the conceptual framework. It's not like primary data, but somehow I have obtained this information from the secondary source and how we can build the community care model to lead the well-being of the welfare of the elderly. So when we talks about this, the population of the elderly 60 and above will grow up to the 11.1% in 2025. So it's a very important to have these kinds of the concerns and to give the first priority to make sure that the comprehensive well-being of the elderly will taken care of. Because now the joint family and the nuclear family is most of the area where we have to do the concentrations where the nuclear family leading the elderly more vulnerable. So that's why it's very important to have certain kinds of the community ecosystem where the older people can get the basic needs at their own areas and the own localities. And if you see the last is predicted that in the coming decades, 2050, the elderly populations in India will reach around the 330 million. So it's very important to have these kinds of the community structure where the local stakeholders and the local institutions will come forward and to take a call on to strengthening the older welfare and the older standards. So this is a methodological part where I have often the secondary source of the information, and the main aim of this paper is to analyze the current situation of the elderly well-being in rural area and to understand the community-based care models, and working together approach with willpower can lead to effective well-being and welfare of the elderly in rural area. So statistical concept and data which have been used from the secondary source, and major long-term objective was that to understand the ground realities of the government schemes which are very important.
Dr. Pankaj, your slides are not moving.
Oh, this way. Now it's moving now, sir?
No, still stable.
Okay, just wait, just give me a second. Now it's visible?
Yeah, please go ahead.
Yeah. So I have covered this slide as well. And this is a methodological part which I have been taken the information from the secondary source. And the main focus of the paper is about to understand the ground reality of the government schemes and the policies, which would mainly focus on the well-being of the elderly in rural area, and to analyze the current situation of the elderly well-being in the rural areas, and to suggest a strong mechanism to enhance the access of this policy and the programs for the well-being through the community action model. So these are the three questions which I have been raised. What is the ground realities of the status of the elderly in rural area? And what are the laws and the policies with relation to the well-being of the elderly? And last but not least, how can enhance the access of the policy to elderly in terms of the improvement of the quality of life at a grassroots level? So if you see, this is a scenario of our population of the elderly, which is a very experienced population, which above 60 years. As per the 2011 census, it shows that the 73.3 million people are resides in the rural area. And if you compare to the urban context, it's higher than the urban areas. And if projecting in 2031, it goes almost the 110+ million. And United Nations also has taken that much of the initiatives regarding the aging welfare. In 1982, if you see the United Nations proposed the International Plan of Action on Aging. It was the first initiative, and the 1991, in a General Assembly meeting of the UN, adopted the action plan and declared the principle for the old age people under the four main themes: independence, participation, care, and the dignity. So along with this, if you see the social, economic, and cultural right also has been given the first priority. And 1999, the major focus was emphasized on the status of the senior citizen in the community, how it is in the rural area, and the quality of life and the development of the old age people, and how we can build the relationship between the generation and to construct the interrelationship of aging and the development. So if you see the Indian context, Indian constitution has given the different safeguards for our senior citizens. If you see the constitutional article number 41, every state shall take appropriate and effective provision for the securing the rights of the old age. Somehow it's a missing at the ground level. That instead of having many schemes and the many programs, but most of the senior citizens are remain without any kinds of the benefits. Article 47 is talks about the every state shall regard the raising the level of nutrition. It's very important to have the proper nutrition of the senior citizen. We have the midday meal, we have the very kinds of the nutrition component for the children at a school and the various Anganwadis, but somehow there is no specific program has been run by the government for the basically elderly population in the rural area, because poverty is one of the most important issue where the rural elder people will not get that much of the nutrition food from their family. And the National Council for the Old Age Pension is about very important thing, NASPE, National Assistance Social Program, and the Maintenance of the Welfare Parents and Senior Citizen Act, which has been enacted by the government to protect the rights of the senior citizens. But somehow the awareness and the capability building among the stakeholders is lagging somewhere. So that's why all the articles are not being implementing properly because of the lack of willpower among the local institutions. And these are the welfare program. If you see, these are the three important welfare program have been divided into three dimensions: food, health, and the welfare. So National Social Assistance Program pension scheme is there, but somehow there is no ecosystem where the people will get the proper pension scheme by minimize the different kinds of the hurdles. One of the Rashtriya Vayashri Yojana, you know that it is a very important scheme where the centrally sponsored scheme, 100% sponsored by the central government, where the device supported scheme, where the artificial limb association, they will work closely with the rural area and the local self-government and to provide the different kinds of the devices free of cost, those who are the physical and disabled persons. Even ear aids and the different kinds of the wheelchairs also supposed to provide free of cost to the Grama Panchayat and different type of the institutions. So since these are the certain areas where we are lagging, and these are the certain problems of aging, social problems, health problems, and as well as financial problems. If you see, the Niti Aayog has been conducting a survey where they have found that at most 28% of the elderly are living with the children without the spouse, and 7 out of the 10 elderly person reside in rural area, and 9% of the women elderly live alone in rural area. So it's very important to have a focus on to give the first priority to develop these kinds of the isolated and the vulnerable population in such a way that we can have certain kinds of the ecosystem through the community model. And health issues, if you see, every fourth Indian over 60 years and every fifth Indian over 50 years reported having poor health. 75% of the elderly have one or more chronic diseases, and 40% of the elderly have one or other disabilities. And around 20% of the elderly in India have mental health issues. This is very important. Absence of the genetic care facilities at a PSCs in rural area is one of the main challenge. Now, there is no such kinds of the available services in the PSC and maybe community centers where elderly can get all these kinds of the services in their in 70, 80 years of the age. And financial dependency also, most of the dependency ratio is raising day by day, and 78% of the elderly population without pension. Since there's a National Social Assistance Program, Indira Gandhi and Old Age Pension Scheme, but still this pension scheme are not getting properly because of lack of the management, lack of the coordination, lack of monitoring, and documentations, verifications, documentary submission. These are the many hurdles are there. So that's why community care model can be taken care of all the issues. And 80% of the senior citizens are covered by the health insurance. So these all the issues can be taken care by the community care model through the Gram Panchayat. So how we can develop this community's care? how we can transform the lives of the elderly in rural area. These are the three important areas that we need to focus. That is means building the knowledge and the awareness among the stakeholders and the local institutions, where we can inspire them to look out the issues and the consequences among the elder people and make them the happy. And the program monitoring and the planning is very important to assist the local institutions in planning, startup, implementations, and monitoring of the community-based care, CBC, and community engagement and action, and components of the CC, community care program for the elderly, in meaningful way. It's not only for the sake of, but somehow it has to be very important to make sure that each elder person can be get all the benefits through these community models. And strengthening the community-based care, working together approach, including the Anganwadi, including the PSC, including the Gram Panchayat, including the different kinds of the association clubs, to build the community ecosystem to enhance the quality of life of the elderly in rural areas. So this is somehow the pyramid which I have thought that these are the three important dimensions that we need to impose: community as a space in the community, devolution of the power to localize the decentralization community, and community as an active subject by the community. So these are the three dimensions we need to focus at a community level through the local self-government. How it's work? This is the last slide of my presentations. Community care models in terms of the medical and healthcare model, care in the community, healthcare facilities in the community, which are the existing, we have to strengthen them in terms of the old age welfare. Decentralize the community, decentralization of the medical care facility in the community has to be updated, and care by the community, proper medical and the health care by the PSCs and the local self-government. That's as well as social care. Elderly are committed in the community. Elderly care committee in the community should be formed by the respective local institutions, and special power in terms of the decentralized community, special power to elderly committees through elderly Gram Sabha, where they can raise their concerns and they can get all the benefits as their socio-economic rights. And care by the community, protection and care by the local self-government is the main responsibility of the local self-Gram Panchayats to ensure this all the welfare and the well-being of the local older people. And last but not least, social inclusion. When you talk about social inclusion at the community, through strengthening the joint family structure and collective approach and working together approach towards the well-being and the welfare of the elderly, and priority to elderly population and protection of rights of the decision making of the elderly, and mass mobilization, good governance, and the social inclusion can be lead the proper well-being and the welfare of the elderly. So let's talk about the well-being of the elderly. It's matter. Thank you very much.
Yeah, thank you, Dr. Pankaj, for highlighting the constitutional and the legal safeguards for the elderly and different policies, and what community-based models
Yes.
is how to work the community-based model for the well-being of the elderly. So that we'll discuss afterwards.